Hearty good afternoon and welcome to our session on the home management of a child with fever. We are pleased to have Dr. Sushant Badatya among us today to educate us on this topic. A fever may seem like a common and often not so threatening symptom to most of us, but it can be detrimental to the well-being of the child. Dr. Susanta will help us understand and go through the stuff that's supposed to be done, the good practices, and what's supposed to be followed at home. Doctor, you have the stage.
Okay. Thank you. Hello, everyone. This is Dr. Sushanta from Apollo Cradle, Motinagar. In this Facebook live session, we will be discussing about the what is fever and how to manage fever at home and when we should do worry and how to go about it. So as we all know, in last 2 to 3 months, as the restrictions and mask policy has relaxed, then the fever incidence has increased in this season. So parents are often worried when my child is having a recurrent fever, and whenever a baby is having fever, then parents just panic. So in this session, we will understand what is fever. So first of all, what is fever? The fever is a sort of body's defense mechanism. Defense mechanism to what? Any sort of insult that body is experiencing, then body is trying to mount a fever response to help body fight against the insult. So the insult may be an infection, that may be a dehydration, that may be any cancerous process, any immunological process. So reason of fever may be multiple, but the most common reason is the infections. That may be viral infections, that may be bacterial infection, that may be a protozoal infection. So every fever uh, doesn't have same reason. So first, we should know that raising the temperature, body is trying to help in fighting the infection in two ways. First, the raised temperature helps in suppressing the multiplication of the germ, so that the growth of the and progress of the disease is controlled. So secondly, it also indication that something worse or something bad is happening to the body, so that we will be acting upon it, so that the thing can be diagnosed early. But fever itself is causing discomfort to the baby. So whenever fever is there, so we should not worry unless there are some danger signs. So first, we should know how to measure fever. This is a common confusion among parents, that what is fever as compared to adults. There is some difference in babies. So how to measure fever and what is definition of fever? So first of all, how to measure fever? So parents often say that we just touched the baby's head and body. It felt warm, so we diagnosed fever. So the touching, the measurement by touching is very crude method and very unreliable, because it just shows the gradient between the your temperature and the baby's temperature. So that is not right way to measure temperature, and it doesn't always give the proper measurement also. So whenever your baby is felt warm, you should measure with some devices. So most devices are like ancient period. The mercury thermometer was very common to use, but as of now, due to risk of toxicity if it breaks, so these are banned in India. So mercury thermometer is obsolete now. So next common device is digital thermometer, that is can be used rectally or armpit or orally. So most common or most useful or very easily you can measure in the armpit, because per rectally when inserted for multiple times, it may cause discomfort, may cause injury to the rectal mucosa. And for oral measurement, due to if there is maybe he's taken some cold beverage or some warm beverage, then that may cause some disturbance in measurement. So best practicable thing is to take it to the armpit. And as of now, there are many devices, the infrared thermometers. They are very popular among parents, but because it is very convenient to use, and it gives instant result. But these are not advisable for home uses, because these can be inconsistent if not used properly. So for mass screening at a hospital setup or any outdoor camp like that, then infrared thermometers are used. Uh, so for practice point, you should use digital thermometer as much as possible. So, what is the definition of fever? Normal temperature is 97.5 to 99.5, or in centigrade 36.5 to 37.5. And feverish definition is whenever rectal temperature is, that is core body temperature. We are concerned with the core body temperature. The rectal temperature is more than 38.1 degree or 100.4 degree. Because we are taking at axilla, the core body temperature is slightly more as compared to axilla. So definition also changes. So whenever the temperature is more than 99.5 or 37.5 degrees centigrade, then we call it fever when measured at axilla. So depending upon wherever you are measuring, the definition changes, or you can add 1 degree to have a temperature for qualifying the temperature for fever. So if we are measuring at armpit, then 37.5 is the cutoff for fever, and if we are taking measurement at rectal temperature, then 38.1 degree is the cutoff for fever. So once we detect that baby is having fever, then what should be the our next management plan? So first of all, we should not panic. Fever is not going to harm as soon as possible, immediately. So first of all, we should have a plan to reduce the discomfort of baby by either decrease the temperature, either by sponging or by medication, or through decreasing the clothing. So first management is to reduce the discomfort. Second is to maintain nutrition and hydration, and third is to investigate for the causes. So first, to reduce the discomfort, we should not attempt to normalize the temperature as soon as possible. Many times parents complain that my baby just having temperature of 104, and with medication baby was having 101 or 100. So the medicine is not working. So medicine are supposed to work like that, that temperature will be reduced, so that with reduced temperature baby will feel comfortable. So it's not about having normal temperature range always, but that comfort level of the baby, if baby is comfortable and playful by that amount of decrease in temperature, then also we are okay with it. So first, avoid overdressing on blankets. Whenever temperature is risen, then parents often try to cover it with blankets and put the extra clothing. So we should try to dissipate the heat. So first, avoid overdressing and blankets. Keep the ventilation of the room good, and you can always keep the temperature 26 to 28 26 to 28 degrees centigrade. And then we should give the medications. Medication, first line or the safest drug is the paracetamol. The dose and interval are decided according to the weight, and interval is almost 4 to 6 hour gap, we can repeat it, but dose according to the weight your pediatrician will guide you. And always it's better, it's good practice to note the dose of crocin time to time, and for each visit during vaccination also you should have a gross idea about the doses for next 2 to 3 months, so that at the middle of night you should not be worrying about dosage and roam around. So next level of medications doctors and parents often use are the ibuprofen and mefenamic acid. But these are not preferred drugs, as these carry a risk of side effects. So unless there is indication and indicated by pediatrician itself, then only these higher medications should be higher medications should be attempted. Um, Even if we are giving medications, if we do sponging with tap water, then it helps additionally in dissipation of the heat. So it's not about that babies when only having 103 or 104 degree we should sponge. To enhance the effect of medications, we can always sponge with tap water, and we should not only put on the head itself, we should wipe it down from top to bottom so that the heat is dissipated. So if temperature rises early or despite of having sponging and medication, temperature is not decreasing and baby is in discomfort, then alternative antibiotic can be used after consulting the doctor. So what should be the isolation protocol for the baby with the fever? So a baby with fever is obviously ill, so that it should they should not be sent to outdoor activity or to school. So they should be allowed to rest as much as possible, and for maintaining the nutrition, uh, you should their appetite is always depressed, so they are not supposed to have the same amount of meal as they were having before. So we should not worry that baby is not taking anything. So it is natural response of the body with the decreased appetite due to either viral infection, due to any bacterial infection. So but we should ensure the intake of fluids or diet as such that baby's body is not affected with dehydration, and the urine output is good, and babies should not feel energyless. So baby should be offered fluids as much as possible, as appropriate to the age group. Like if the baby is less than 6 months, frequent breastfeeding ORS you can offer, and after 6 months the other fluids like coconut water, ORS, milk, they can be offered sip by sip. And if babies are taking the good food, then that is good. So they should not be allowed to go to school as much as possible, as there's some viral infections, they may be contagious. So they may spread to other healthy children at school. So next comes the role of antibiotic. Many times parents start antibiotic at first day itself, but you should know that only the bacterial infections need antibiotic. So most of time these are viral infections and they do not need antibiotic, and indiscriminate usage of antibiotic is going to harm the antibiotic baby in form of development of antibiotic resistance. So yeah. So antibiotic decision should be left with the pediatrician itself. So what should be our priority during management of fever? So we should identify that if there are some reassuring signs and some non-reassuring signs. What should be reassuring signs? If even a baby has a fever for first 2 days, 3 days, 4 days, if the temperature decreases with medication, and baby is playful and active during interfebrile period, then we are not going to worry for that duration. And baby is active, playful, like they were before the illness, then we are okay. And baby is passing urine normally, like 5 to 6 times a day, and the baby is accepting fluids as we discussed, then we should not be worried for first 3 4 days. If baby have some signs like baby is having extreme lethargy, drowsiness, excessive cryo-irritability. The baby is not behaving normally. So during fever, baby may be irritable or cry instantly, but if with the help of decrease the temperature and giving comfort, then these are not any worrying signs. And baby is having repeated vomiting. There is a severe headache. Babies, the older children may complain of severe headache. There is abnormal movements like any fits like action, or fever more than 104 degree repeatedly, or fever persisting more than 5 days. So these are the things we should be of aware that these illnesses should not be managed at home anyhow. So they should be consulted with the pediatrician to find out the reason. So first 3 4 days we can manage at home if babies are having reassuring signs like we have discussed. So there is another aspect to management of fever, that some babies between 6 months to 5 years, they are prone to having to have seizures during fever. So these are called febrile seizure. So the risk of febrile seizures are more with the babies who have family history of seizure, and or they have similar episode in the past. So but the good thing is that these are not related to any brain damage or incidence of epilepsy in future. So there is no risk of brain damage or further epilepsy in the future on having simple febrile seizure. But there are some conditions like having multiple episode of seizures in first 24 hour itself. Then these are called atypical febrile seizure. So whenever your baby is having seizure during a fever episode, you should visit a pediatrician. The pediatrician should decide whether it is simple febrile seizure or or this is a complex febrile seizure. So complex febrile seizure or atypical febrile seizure, they need evaluation. And for plain simple febrile seizure, we can manage at home as per the medications. You should consult doctor. So, summarizing, we should be very particular in measurement of fever, and should be sure about the dosage of the antibiotic, and during the fever episode what should be our action, we should be aware. And if there are some reassuring signs, then we can always wait. And if there is non-reassuring signs or fever is persisting more than 3 4 days, then you should go to pediatrician for evaluation. The evaluation for either whether it is a viral fever, whether it is a bacterial fever, whether non-infectious regions are there, then accordingly the plan of management can be uh, formulated. So I think we are done with the session. Any questions or okay. So there are no questions for this session. So we can wind up the session now. Thank you.